Welcome to the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.
Dr. Josh Luke here with episode 2 in the Health Wealth Basics series of the Health Wealth Podcast. So welcome. If you were able to listen to episode 1 was about consumer-driven healthcare and engaging in the process, and how if any company or even a family is going to drive their healthcare costs down, they have to engage in the process. They have to become what I call an EHC, an engaged healthcare consumer. And just like as when you would buy a house or buy a car, you're going to shop price and quality, you need to start doing the same with healthcare. As the employer, it is your responsibility to provide your employees with the resources to do that shopping to become an EHC. And that's actually part of today's episode, which is called Creating a Health Wealth Culture. And creating a health wealth culture is really an all-encompassing corporate commitment and campaign to give your employees the resources and tools to become EHCs, engaged healthcare consumers. Once you have done that, you're going to start to see your healthcare spending, particularly your wasteful spending, go down. So will your employees, and they'll be grateful for that. So let's talk about what a health wealth culture is. A health wealth culture is a culture in which the organization from the top, the C-suite, if you will, is committed at every stop of the way to a healthy workforce. And let me give you an example of that. In my 10 years as a hospital CEO, I always challenged my executive team, my senior team of 4 or 5 folks, to each volunteer to be on one charity board, and hopefully to a charity that was connected to healthcare. And the third request was that hopefully that charity had some sort of physical fundraiser every year, like a bike ride or a memory walk or a jogathon or a run. And my personal commitment, as many of you know, has been to raise money for Alzheimer's with the Alzheimer's Association, the Youth Movement Against Alzheimer's, and here in Orange County, California, with Alzheimer's Orange County as well. I'm passionate about raising money to benefit each of those organizations. And in my roles as an executive, I made sure I wore that on my sleeve. And really that's part of what being a health wealth culture is looking around your executive table and asking each of your executives to make a commitment to some sort of charity or some sort of charity event, if they don't want to be on the board, that they can co-participate in and maybe be a team lead. And look, if somebody's a bike enthusiast, obviously they should be the one that commits to the charity that has the bike race. If somebody's a big jogger, then they can go to the one that jogs. But that's really what your employees are looking for, is to see that from the top your organization is walking the walk and talking the talk. So that's one step in having a health wealth culture. Another that you hear a lot about is, hey, just look at your vending machines. Are you feeding your employees foods that are working against them being healthy? And we hear a lot about wellness, or what I like to call healthy lifestyles in this day and age. One of the easiest ways to get your workforce to be healthier is to eliminate easy access to junk foods and soda, and to enhance the offerings you have that are healthy, whether it's water, or whether it's vegetables, foods that are high in protein, whatever it might be. Those are offerings that a lot of companies have shifted over to instead of soda or snack food. So that's kind of an easy one. But what about a walking club at lunch? What about an advertising campaign, an internal advertising campaign, where each week you have a thought for the week or a challenge for the week? Another tactic that many organizations are using, and even in the Affordable Care Act, there was a requirement for healthcare organizations to implement some sort of employee incentive program to live a healthier lifestyle. These are turnkey programs that you can sign up for. And a lot of people perceive, oh, I don't want to sign up for that program because they're just going to reward that guy that runs marathons or the lady that runs triathlons all the time. That's not how those work. They establish a baseline for each and every employee, you included. And then you set goals, and as long as you're working to achieve those goals and you start to achieve them, you get rewarded with either gift certificates or other prizes along those lines. So those gamified healthy lifestyle programs, if you will, have become very popular in American culture. And another thing you can look at when you create a health wealth culture is are the sidewalks around your workplace conducive to jogging and walking? Are there bike lanes, accessible bike lanes around your city, around your community, around your place of employment? Are you influential enough in your community to go to the city council and to lobby for bike lanes? So these are all things that when you start down the path of educating your employees on how to save money and improve access to health care, consumerism, if you will, that process is going to be much tougher if you don't at the same time prioritize creating a health wealth culture in your organization. If you want to learn more, you can check out the book Health Wealth: Is Healthcare Bankrupting Your Business? You can go to healthwealth.com. You can actually do a loss assessment on healthwealth.com that will tell you how your organization is doing and if there's a lot of wasteful healthcare spending. So that's going to wrap up episode 2 of the Health Wealth Basics series about creating a health wealth culture within your organization. It's Dr. Josh Luke with the Health Wealth Podcast. Thanks for joining me.
Thanks for tuning in to this episode of the Health Wealth Podcast and Radio Show with Forbes author and contributor Dr. Josh Luke, America's Healthcare Affordability Authority. Visit drjoshluke.com for information on speaking appearances and other resources.